was really excited about the thought of engaging with our patients earlier and helping them get into the best physical and emotional and financial state possible before they have surgery. At this stage of the redesign, what we're looking at is changing our preoperative preparation process. We're preparing the patient in the 30 days or so before their surgical procedure to get them optimized and ready for surgery. And the theory behind that is that when they're better prepared for surgery, they understand the expectations that their hospital stay will go better and their recovery will go better. Definitely our lengths of stay are a lot shorter than they used to be. And with knowing that, we need to have our patients better prepared for what to expect before, during, and after surgery. If they're coming into the hospital for surgery and they think that they're going to be staying for 7 to 9 days and they're actually staying 1 to 2 days, they're not going to be prepared to go home. So we need to make sure that they understand that very well. There's a lot of changes in the guidelines for what we do preoperatively. An example being the preoperative fasting guidelines. We no longer keep people without food and drink for several hours before surgery. They can actually drink up until pretty much till they come to the hospital in the morning. They can drink clear liquids. It not only makes the patients happier, but it also helps us care for them better because they're not dehydrated. The other thing that we found, and it was pretty strongly told to us by our patients, is that they were getting a lot of information that sometimes conflicted from different sources. And we realized that we really need to standardize what information and education is going to our patients and that they understand it. It's not confusing and it's not contradicting itself. We have a very large multidisciplinary team, a large group of nurses from surgery, peri-op, prepare clinic, folks from the general nursing, a lot of different disciplines involved. We've got physical therapists and other types of therapists. We've got nutritionists. We've got case managers. We have anesthesiologists. We have surgeons, primary care involved, and of course transitions of care involved. That's one of the biggest components of this process is the transition of the patient from their medical home through to their surgical home, and then after recovery back to their medical home. So we need to have them involved. The ultimate goal is every patient, whether they're scheduled for surgery or not, would be always prepared to have surgery. They would always have that optimization done with every visit. Just partner with them to help them understand that if you have to have a surgical procedure because of this or this, let's say smoking, because you're smoking, you run a higher risk of a postoperative wound infection. You really need to stop smoking, and here's the tools to be able to do that. That would be the ideal world. Probably not in 3 to 4 years from now, but that would be the ideal world.